Good morning everyone. I am Dr. Soma Srikanth, Consultant Surgical Oncologist at Yashoda Hospital, Hyderabad. Today we will be discussing about ovarian cancer. Worldwide there are around 3 lakh cases which are being detected on an annual basis, and we are also losing around 2 lakh patients per year worldwide. The main reason for this is most of the patients are being detected at an advanced stage. Approximately 75 to 80% of the patients come to us at stage 3 or stage 4 condition. The common age group for ovarian cancer is around 55 to 65 years old. What are the symptoms of ovarian cancer? Generally, there are no specific symptoms for ovarian cancer. In early stages, the patient might experience low pelvic pain or abdominal pain. They might have a feeling of bloating sensation or irregular menstrual periods or vaginal discharges. In advanced stages, we get to see patients with abdominal distension. This is due to fluid within their abdominal cavities. They might lose appetite. There might be a significant loss of weight, and patient might also be having bone pains and other symptoms like cough or breathlessness due to fluid being collected in the lungs. These are generally seen in advanced cases. The risk factors for ovarian cancer. Generally, age is a significant risk factor for ovarian cancer. With increasing age, the risk also increases. Generally, people who are above 50 years of age, with each year there is an increase of 2 to 5% per year of an increased risk of ovarian cancer. The other risk factors are generally due to genetic causes. Approximately around 5 to 10% of cases are due to genetic causes like BRCA mutations, BRCA1, BRCA2. And the other risk factors are early menarche, late menopause, or women who don't have any pregnancies during their lifetime. We also call them as nulliparous women, and who do inadequate breastfeeding during their lifetime, and who have late pregnancies. Generally what we have seen is in other studies and all, they have shown that pregnancy after 35 years of age have shown to increase the risk of ovarian cancer in those women. The other risk factors are obesity, smoking, or usage of hormone replacement therapy for longer durations. How do you evaluate for an ovarian cancer? So the basic investigation for any patient with such symptoms are ultrasound abdomen. So when we detect a mass within the abdomen which are arising from the ovary, then we proceed with other investigations. There is a basic blood test called CA-125, which is a blood test which is generally elevated in advanced ovarian cancers. The other tests depend on the staging. So we generally do a CT scan or MRI scan to know the characteristics of the mass, what stage it is in, and right now nowadays we are even doing PET CT scan to even evaluate the other organ systems, so to decide on the stage. So what are the treatment options we have for ovarian cancer? So generally ovarian cancer treatment generally revolves around surgery and chemotherapy. So generally if it's an early stage, we generally prefer surgery. In engaged women who generally have germ cell tumors, we generally preserve the uterus and the opposite ovary. We just remove the ovary on the same side, and we do pelvic lymph node dissections. These are generally nodal tissue and the fatty tissue on either side along the vessels, and also omentectomy. This is generally a fat tissue below the stomach. And in elderly patients who have completed the family, or some younger patients who have completed the family, we generally do in epithelial ovarian cancers is we remove the uterus, both the ovaries, along with that the nodes and along an omentum. And generally chemotherapy generally involves 6 cycles. And if it's an early stage, stage 1A or stage 1B, only surgery is sufficient and the patient can generally be under follow-up. Stage 1C and above and advanced cases, we generally give 6 cycles of chemotherapy. So what is the sequence of treatment? Either surgery first or chemo first, generally depends on the stage you present in and the nature of the disease within your abdomen. So if it's a very advanced stage where surgery is not feasible in the first sitting, it has spread to liver or lungs and everything, we generally give chemotherapy first, and then we reassess the patient with again a CT scan or a PET CT, and then we decide on surgery after 3 cycles. And if the surgery is feasible first, we generally go with surgery, and based on the report we give adjuvant chemotherapy. So there are multiple new options now. We have targeted therapies, immunotherapies also coming up in a big way, and which have shown very good results and improving the survival rates of patients with ovarian cancer. Is there any prevention for ovarian cancer? The answer is no. There is no miracle drug or any injection which can prevent ovarian cancer. Only thing is, when you have symptoms, try to consult your doctor at the earliest and get a scanning done, so that we can detect them at an early stage and cure your problem. And those patients who have a genetic issues, we generally ask them to get screened for mutations, BRCA mutations or HMPC syndrome mutations, so that we can detect them early. And if those mutations are detected in you and you have completed your family, we generally prefer doing a bilateral oophorectomy to prevent the occurrence of ovarian cancer in such cases. Thank you.